All right, now let's look at the small group side of Broker Engage's code-to-card functionality. As I mentioned earlier, we have probably the largest aggregation of carriers for small group fully insured plans. We have over 500 carriers from all over the country. So it doesn't matter which state you are in, pretty much all the carriers that you may have in your states that sell small group plans should be on our platform. I'm talking primarily of the fully insured plans. We don't have level funded plans yet. That is something that we are working on bringing in. But all the fully insured plans are all there for pretty much all the carriers around the country. Let's see an example of how you can quote and enroll customers as far as small groups are concerned. And you'll see how powerful and how mature the tool is for small groups. So first of all, the ability to quote for a small group can be done in multiple ways. You can actually go into quotes and do a quick quote without actually entering a customer or a group's information. You can just go into quotes directly and create a quote from here, which this is a process we call anonymous quote or quick quote. Or you could actually go into your employer section and do things the more traditional way where you actually enter the group's information as a prospect and then quote for that particular group or prospect, right? So let's try that. So here's an example, a group that I'm going to just create as a prospect. As you can see, as far as creating the group record, you just need some basic pieces of information, not a whole lot. And I'm just going to enter some basic information. The address, I will give this, let's say, a Houston, Texas address. Right. As I mentioned, the platform is available in pretty much all the states in the country, so it doesn't really matter which state you guys are. To create the prospect, pretty much demographic information is sufficient. Let me just the email address. All right, and once you put your basic information, it creates that prospect right there. Now to create a code, all you have to do is just click on this button, create code, and it tells you that we have the ability to create codes for medical, dental, and vision. So let's start off with medical, right? This takes you to the coding screen, and you can see that pretty much all that information that could be populated is already populated. The zip code, the name of the group, it picks up the next coverage date, which you can always change from here. You have the ability to code either age banded or composite rate. Both those options are right there. Now, in terms of providing the census, you can provide that in a couple of different ways. First of all, if the group is really small, then all you really need to do is just enter the number of employees right there. And then what the system does, it creates a dummy grid for you, which you can just edit things right there on the screen, right? So for a really small group, you don't want to go and get a census file uploaded and all that. You can just type this thing right here on the screen. That way, even if you're using a phone, you could just type things and just upload things from your phone. If there are more than a few employees, then you're probably better off uploading a census file. Let me show you how that process works. So I just uploaded a census here. The template for that census file is right there. It's a very simple template with just some basic information. And as you can see, it populated the grid with the real names now because I uploaded it from the census file. Now, you still have the ability to update these names or their date of birth or any of their information if you wish to. So even after you upload it, you have the ability to change things. Now, if this was an existing group, you would see another tab here called Saved Census. And that saved census is primarily allowing you to pick the census from one of the previous codes for this group. And it's a very nice feature because if, for example, if you're just trying to renew a particular group or generate a renewal code, you can just pick the code from last year and apply the census from that last year's code. And once you apply the census, you can edit the screen with any adds or delete that they may have had during the year. So there are multiple ways you can provide the census, and that's the nice thing. The platform allows you different ways to improve your productivity. Now, when you're ready, you just click on that See Plans, and it will open up all the plans available for that particular zip code that we entered. Now, this one is for Houston, Texas. As you can see, we have 481 different plans from a number of different carriers right there on the screen, right? Once again, you see all the filters on the left hand side. You can see that you can filter by plan type, you can filter by metal levels, you can filter by the premiums, deductible, even the carriers. You see all the different carriers. You see plans from Aetna, you see Blue Cross Blue Shield of Texas, which is probably the more dominant carrier there. You also have a bunch of plans from Humana. You also see Memorial Hermann, which is another local carrier, very popular in Texas. And then Scott and White is another one which is very popular in Texas. And then, of course, good old United Healthcare is also right there. Right, so you see all these plans from all the different carriers. Those people who are from Houston would realize that pretty much we have all the carriers that you may be working with. Now let me describe these plans in general. Once again, you see that each carrier's plans are described in a very consistent manner. You see all your key benefits right here on the screen for each plan. You click on Show More, it's going to show you more of those key benefits. It's going to show you office visits, ER visits, and prescription drugs. If you want to see all the benefits in a single page, you can always click on More Details, and it will show you all the benefits on a single page, very nicely laid out for you. Once again, if you want to email this to the customer, you don't have to go anywhere. You can just email it directly from here. You can change that email address or whatever, and then it sends it to the customer. You can also download this as a PDF or print it right from here, right? Also, if you prefer to see an SBC, just click on that SBC link, and it will open the SBC document for you, right? There you go. See that? There's your SBC. So all the tools that you need to really understand what the plans are best for your customers are all in there, right? And now if you want to compare anything side by side, that's also very easy to do. I'm going to do a few of these right here on the screen. Alright, let me just pick maybe another one. Just trying to pick another carrier here. Okay, let's try that. Okay. Alright, so you see all of these plans side by side, very nicely laid out. All the benefits are nicely laid out. You also see the monthly premium right at the top. Also, if you have to email this to the customer, you can email it from here, download it, print it. All of those features are very consistent. Now, if you wish to see the rates for each employee, you can do that too. Click on this About This Rate. It's going to show you all the rates of each employee listed nicely right there, right? So you can see all of them right here. If you want to understand the split between how much the employer pays and the employee pays, you just move the slider from here. If the employer is going to contribute, let's say 50% of the employee's premium, there you go. You see the amount changes right there. Same thing if the employer is a nice employer and wants to contribute a few bucks for the spouse and dependents, you see that amount gets updated right there, right? So all of those features you can very easily use. You can provide this contribution either as a percentage or as a dollar amount. Now, if you wish to see all of this in a nice proposal, just add things to the cart. I'm going to do a few of these to the cart. Let me add a few different types of plans here. Maybe one more from Aetna. All right, so now I have moved like 6 medical plans into my cart. Now, if you want to see some dental plans in the same proposal, fairly easy. Go back to that menu and pick up all the dental plans. It takes you back to that quoting screen. If you want to change anything here, let's say the census, let's say it's different, or the effective date is different, you can change all that, right? So if the company doesn't offer dental benefits to all its employees, you can change that. If it needs to start on a different effective date, you can change that too. And now you see all the dental plans right here on the card. Okay. Um, and I'm going to add a few of these dental plans in here too. Now when I go into my cart, I do see all the plans nicely laid out. Okay. Um, I can remove things from the cart. I can go back to my shopping. Or if I am ready to generate a proposal, I can do one of these three things as far as proposals go. I can email the proposal to the customer. I can save it right here. I can download it right here. If I want to email the proposal, it gives me a couple of different options for proposal. Once again, I have the option for either PDF or Excel. Now on the group side, we have two different proposal format. One is called the long form proposal document, which has a lot of information about about the plans and the groups. The other one is an executive summary, more like a one pager. Let me show you both of them. And once again, the nice thing here is if you say yes to this enroll link question, it will include an apply link right there on that proposal for the group to self-enroll. So this is another nice feature. If you don't want the group to self-enroll, if you don't want them to complete an application on their own, you can click no here, and it wouldn't add that link. So let me send that as an email to the group's email address. Right, it should show up there in just a minute. Also, if you are ready to do the enrollment on the group's behalf, you could do that too, right? So I can just go in here, select, let's say, multiple plans for this particular group. If I want to add some dental plans also, I can do that. I can add any dental plan if I want to, and then actually go in and start my group application right here. So not only can it send some great proposals, but you also have the ability to complete that application right here on the screen. Let me first show you the proposal, and then I'll come back to the application process. It should show up. Yeah, there you go. That's the proposal. Now let me just open up the long form first, and then we will open up the there you go. This is the long form. Once again, this is the Excel version that I downloaded. So on the long form, you see all these different tabs at the bottom. There's a lot more information that the system has for this. So once again, you see your cover letter, your logos, your contact information. You click on Employee Census tab, you see all the census information right there. Then you click on Health Rate Details. It will show you the rates for each member of each employee in that group. It will show you for each plan. See that nicely laid out. If you want to see the composite rate, you can see all the composite rate, the 4-tier rates for all the coverage tiers for each plan is listed right there. Then if you want to see here's the dental rates, and then same dental composite rates, and you have the caveats, right? So you see all of that features are right there as far as the group's long form proposal is concerned. If you want to see the one pager, which is the executive summary, that's also right there. Let me just open that up for you. So here's the one pager, right? So in the one pager, you are basically seeing everything nicely concised in a single page. by health, by the first page is a summary, so it shows you by line of business, by carrier, by plan, plan type, monthly cost, total monthly cost, annual premiums. Then for each line of business there is also a single page. Here you see all the 4-tier rates. You also see by carrier all the key benefits and the employer and employee cost for each member of that census. So you see all of that nicely laid out for you. And the same thing you see for dental too. So you see how detailed your proposal generation tools are. Now, as I said, if you want to complete the application, you can do that too. I can go through this entire process right here without having to the groups or the carrier's website. Let me just see if I can go through a few steps here. So those of you who do group benefits, you will see how easy this process is. It has all your eligibility information. If you want to add any classes, that's also fairly easy to do. I can add these classes, I can add my waiting periods, save that. There are multiple locations in the group, I can add that too. I'm going to skip all this. Now let me also show you how easy it is. Now this is you doing it, right? So if you had allowed the group to do self-service, that's also possible. But either you as the agent or the group can complete this process. If you want to upload a roster from the group, you could do that too. I'm going to do that now. Just upload a roster. There you go. It loaded all the employees' data. Now, if you want to export that back into an Excel spreadsheet, you could do that. Or you could just complete the application right there. Now by default, if you have there are multiple plans here, so by default it's going to assign the lowest cost plan, but you have the ability for each employee, you can go in and change the plan details. You can also decline the plan if that employee doesn't want to enroll, and you can do that for each employee in that group. I'm going to go through this process fairly quickly. There are a few more steps here. And then any attachments that you need to attach, that's also there. And you can see I'm reaching pretty much the end of the process here, entering the binder payment information, and you can see that I completed the entire application right here online through this process. So that's the enrollment process. Probably there's one more step here. I'm going to just click that and say finish. And if I go back to the group's 360-degree view, so first of all, if you have set up your trading partner information here, it would automatically submit that to the group's website, so you don't have to do that double entry. Also, along with automatically submitting it to the group, it also creates the actual PDF files for you. So if I open these documents, you will see the actual applications for both the group as well as the employees. So here's the group application. You can see all of that nicely done here, and the same thing is also there for the employees, right? So you see how powerful the tool is. It's not just a quoting tool, it's a quote to cart tool. So it allows you to do the entire group application and the employee application right here on the platform, generating some great proposals in different formats for group health, group dental, as well as group vision. All right, so that's the small group side of things.